Hello guys, Dr. Nick here. So this is our monthly video, and on this one we're going to be talking about some questions that we find on Google. So the most searched Google questions for chiropractors, and I'm going to answer some of them. So the first one is, what exactly does a chiropractor do? So chiropractor, our really main focus is on obviously the spine. So we look at spinal function. So if you're watching this, either you've been adjusted or interested in it. The spine is one piece of the puzzle, one gigantic thing, but it has huge amounts of different types of joints, and each vertebra area has a different shape to it. And so as a chiropractor, we analyze, we analyze, and we correct segments that are not working very well. They could work a lot better. And that's pretty much it. We look at those areas and we correct them. And then it comes down to another question is, do chiropractors really help? So the thing is when the spine's not functioning very well, or so that segment of the area is not functioning very well, and those segments control different areas of the body or affect different areas of the body. When they're not functioning very well, it affects that area. And so symptomology, you could just feel pain, right? You feel uncomfortable. But going a little bit more deeper, it can affect brain function, how you perceive pain in the brain, stress, immunity, all these studies that are coming out that it affects body function and how the body really adapts to stress and adapts to the environmental stimulus that are coming into the body. Which is pretty crazy and pretty cool. There's a link between the spine function and the nerve system, and thus the brain, and how the brain will then heal the body. But obviously, chiropractic can really help with spinal pain. The big thing is the spinal pain, the headaches, the irritation in the brain, sciatica, so nerve stuff that's going down the leg, arm pain, shoulder pain, muscle pain. Lots of that stuff, and it really does help. But everyone is different. Everyone has different circumstances, issues, and so it doesn't help with everyone. But specifically, what chiropractors focus on is the spine and spinal function, and how it helps is by aligning or getting that functioning better. It can help with how that area influences the rest of the body. Now, another question is a chiropractor a real doctor? So I'm allowed to call myself Dr. Nicholas Stott as a chiropractor. Here in Australia and America and New Zealand, you can too, and I think in the UK as well. No, we are not medical doctors. We're not GPs, we're not in the medical realm, but we are allowed to have that title because of what we study. The range of study, and that's another one, is it a medical degree, and how long it is the other question. And so a long time ago, there's a history with this over in America where it sort of first grew and became in university, is chiropractors were claiming stuff, and medicine was upset, and so there was a court case, and chiropractors won that court case to say that we have rights and we can do this because of what we've learned and what we study. So chiropractors are not medical doctors, but we get that title because of what we study. And in university, we study really similar stuff as a GP, but GP is far more extensive, and they have to know everything, and they've got to try and diagnose everything compared to a specialist. So they study a lot on diseases and drugs as well, and medication. The chiropractic touches that realm a little bit. But we study a lot on the human body and physiology and diagnosticking, and it's a 6-year degree. So in Australia, you have to do a degree and then a 2-year master's. So it's 6 years, and then plus you have to have 2 years of clinical experience before you're allowed to see or graduate and be on your own in the public. So there's a difference. So we study a lot, we get that title, we want to use it, we're very different to the medical realm, which study a lot as well, and they know a lot too. Is it worth being a chiropractor? I think so. I love chiropractic just because of really what we study as well, and then what we can actually physically do with the body. We got a hands-on approach. We can really analyze. I can take x-rays and analyze x-rays, and random people that come into the office, we got to really see if they're going to be okay, if there's other external crazy stuff going on, and we learn that stuff as well. And so with that knowledge and the other stuff that we can learn on ourselves and experience in clinic as well, over the years with dealing with clients, I just enjoy it. To see the change of some people and the challenge of not being able to help some other people and trying to figure that out and why that is. And but the beauty with chiropractic is really understanding our relationship between ourselves and the environment, and see if there's blockages in our body, and if it can actually heal itself, or we need external things with going to medical intervention with medication or surgeries. I hope that answers maybe some things that you were thinking about, but they're the questions that I wanted to talk about today with some recent searching. If you've got any other questions, let us know and I can maybe answer them for you. Till next time, have a great day.